So, my background is that I'm a nurse. I have a PhD in nursing science, and at the moment I'm the chair of IMIA-NI, International Medical Informatics Association Nursing Informatics. In my daily life, I'm the managing director of VAR Healthcare, an evidence-based decision support tool for nurses. The development of nursing informatics started already in 1966 with the first interest in computing in nursing. And the International Medical Informatics Association started up in 1967 as an association and became an independent organization in 1979. Already in 1982, the nursing informatics was established within IMIA as a working group and later expanded to a special interest group in 1995. And as we can see, the mesh term nursing informatics was established as late as in 2005. It takes time to get on the list of mesh terms. That means that we have enough research in 2005 to become a mesh term. So there has been a lot of activities since 1966. IMIA-NI is the most active group in IMIA, and we have had rewards for the Best Working Group Award in 2013, 17, and 20. And we know that this year, IMIA-NI will become an independent group. So we are still expanding. IMIA-NI has the aim to share knowledge, experiences, and ideas with nurses and healthcare providers worldwide about the practices of nursing informatics and the benefits of enhanced information management and education. And the focus of this group is to foster collaboration amongst nurses and others who are interested in nursing informatics and to facilitate further development of the discipline in the field. So it's very scientifically based and education, and it's a lot of experts within nursing informatics and interest within nursing informatics who are engaged in our group. And how are we organized? Well, we have an executive committee consisting of 5 members. So except for me, we have the vice chair for membership, who at the time is Joy Lee from Taiwan. We have the vice chair for administration and finance, who is Margie Kennedy from Canada. We have the vice chair for communication, who is Michelle Honey from New Zealand. And we have the vice chair for previously called working groups, but now advisory panels, Nick Hardiker from UK. This is an organization who are based on working by bylaws, and we are working more strategic with strategic plans in alignment with the medical part and the main organization. One of our main tasks is to arrange international conferences and congresses, and we do that every 2nd and every 4th year. We have 29 society members. That means that the society within informatics mainly is a member of IMIA, and we have representatives in the medical part of the organization as well as in nursing informatics part. And from Sri Lanka, we have Dr. Sudat Branakula Surya, who is the representative from you. In addition to the society members, you can be an institutional member of the organization. That could be a university, a hospital, any organization interested in developing and collaborating within informatics. We have 30 honorary members, and honorary members, they are specialists in the field who has contributed a lot within nursing informatics. It is also the previous chairs of IMIA-NI. And they are quite active. Even though many of them are retired, they are working a lot to promote nursing informatics and to collaborate and improve practice together with the chairs and the main organization. And we have 4 advisory panels. And what is that? The advisory panels, we have organized them in 4 areas. Practice could, for example, be evidence-based practice under the lead of Robin Cook. We have the group advisory panel for governance under the lead of Laura Maria Peltonen and William Goosen. This could be focusing on, for example, interoperability, terminology standards, and so on. We have the group for education under the lead from Max Topas. Education has a lot of activities to strengthen NI within education as well as to educate within NI. And we have the final advisory panel of research under the lead from Leanne Curry, focusing on research with and on and together with informatics in nursing. The advisory panels are working together with the other EMEA representative groups. That could be primary healthcare informatics, that could be telehealth, that could be various groups of social medias and so on. But one of the groups that we are working mostly with is the students and emerging professional within nursing informatics. It's a subgroup within EMEA and I. So there's many possibilities within EMEA. But how is EMEA and I working? Well, we have two roles. We have a reactive role and a strategic role. In the reactive role, we are focusing on the scope of NI and exploring that field. What is going on within nursing informatics today? We are supporting our members in many ways and facilitating members' potentials. So it could be that you want to expand your career within nursing informatics and you get into a society with the common interests as yourself and with your research. We are integrating meetings with other nursing informatics groups, as I just told you, and we are sharing developments across countries. And that's quite interesting to see the commonalities and the differences across countries and how we could merge those together and paint a picture and the foundation for further development and research. And we are initiating and facilitating publications. On the strategic side, we're working strategic with the strategic plan. What are the next steps? In what direction should nursing informatics go? Where do we need more development and support? We are also working on prioritizations on which issues that needs to be addressed as part of the strategic plan, but also more concretely. We are initiating task force meetings. We are ensuring that the conferences that we are in charge of are based on current relevance and future significance. And we are recognizing experiences of the group members and channel their expertise, skills, knowledge to meet EMEA and I's vision, aims, and objectives. That means at the same time as reactive, we work more strategically to build up and support and help you. So what have EMEA and I achieved? That's a lot, so I will just show you a few examples. There has been work around fundraising, and here's one example from Canada. We are working with publications, and I'll show you a list of some of the publications afterwards. We are setting up workshops, panels, presentations at eHealth and nursing informatics conferences globally as well as regionally and also supported locally. And we are working towards health political strategies and efforts as well. For example, to put NI on the agenda in Canada, EMEA and I was supporting that. They were working on this health data ecosystem. I told you that one of the main activities of EMEA and I is to arrange congresses and conferences. And here is one example from the experiences of arranging the Nursing Informatics Congress in 2014 in Taiwan. What did they learn and what did they achieve from being the hosts for this conference? Well, they strengthened the collaboration between the various professional nursing organizations in the countries. They had to collaborate to put up a global conference, international conference like this. And they are still collaborating today. They enhanced the visibility of nursing informatics within Taiwan and show that nursing informatics is quite big globally. And they collaborated with the government and the Ministry of Health. They strengthened the cross-industry marketing skills of professional teams and learned that could gain both the private organizations, the nursing organizations, as well as the business collaborations. They exchanged expertise and networking globally. And as Joy told us when she presented this, they made friends for life within a special field of professional nursing informatics. And they also established a global platform for sharing nursing informatics related information. So that was quite a big success for Taiwan, for the Taiwan nursing and nursing informatics, as well as the EMEA-NI and the global nursing informatics. There are some key milestones that we're very proud of, based on collaborations and within the focus and this advisory group or working group of standards and governance. The reference terminology model for nursing, the ISO 18104, was established in 2003 and also further developed in 2014. We also have the International Nursing Minimum Data Set, which was developed in 2000. Those two main works that is still in use and spread around the globe was made in collaboration with and used by International Council of Nurses and the WHO. This also affected the development of ICNP and SNOMED CT, which are the two only reference terminologies and advised to be used back-end in any information system of healthcare to provide information for statistics, further development, outcomes, measurements, and so on. The healthcare standard has been, it's a lot of more work, for example, with the LOINC, also the ISO 13972, and now the ISO 18104 is under revision of one of our members, Dr. Hovenga, and also you can see the name of Dr. William Goosen, who has been doing a lot of achievements within this field. But one of the national results and successes from using the standards ICNP, I will point out Portugal as a country, because they decided that ICNP should be part of the all electronic patient record systems in their countries. So now they can locally in one hospital or one area of the country, as well as regionally and nationally, follow up on nursing indicators. They can rate the effectiveness of preventing complications in the country, as well as rate the resolution of or status improvement of areas. And this is in Portuguese, apologies for that, but as you can see, they have a big overview and the health authorities can make decisions based on the statistics that they make from those standards that are used. In the Netherlands is another example. They have a new legislation in preparation for the electronic exchange of health data based on HL7. And this is not well established yet, but it will be in use in the next years to be followed. And the nursing perspective and data based on nursing is very central. And they have one example of the e-overdraft in elderly care. Within the advisory or working group area of education, there are also a success and results to point to. There has been a lot of work globally as well as nationally and regionally in putting in nursing informatics as a topic into education at every level, from the bachelor, master's and PhD level. And it's various across the countries how far they are, but we see more and more that nursing informatics is part of the education, even at the bachelor levels. They have been working for positions for nurses who are educated within nursing informatics, and Chief Nursing Informatics Officer is a title that comes more and more. And this title and this position is very important in the further development to ensure good development of various type of softwares, hardwares, and so on. They have also been working with supervision and education from the members. And as Dr. Patrick Weber told you, working with mentoring system is one of the things that is an example. But we also have an example from our members. Paula Proctor, for example, is working as an international advisor to the Republic of Ireland's framework for nursing digital competencies. And this is the way that our members are working and supporting the development of informatics. And not last but not least, collaboration across countries is a very important part of EMEA-NI. And NAIL is a very new element based on collaboration within education, where nursing and an artificial intelligent leadership collaborative has been developed with more people than Max Topos, but with a group of Max Topos. And here is one of the publications that they put out. And as you can see, there's a lot of names here. And you can also see Patrick Weber is one of the persons behind this work. And we also have to mention the Tiger Initiative, who has been an initiative for many years and a collaboration across many countries. And I put out a link there so you can have a look at it. And that has been a collaboration with HIMSS. They have, amongst others, Health Informatics Guide, Core Competencies of Health Informatics, Academic Education, and Workforce Development. So there are sources for further education within education. Within evidence-based practice, there are two main works that I want to point out. The work from the University of Minnesota's Big Data Initiative, led by Connie Delaney, and the Big Data Initiative Working Group for the e-repository under the work from Hardy, Bonnie Vestra, Charlotte Weaver, Jane Carrington, and Mary Beth Slobodnik. I don't want to go through this, but here are some publications from the members from 2021. I haven't updated it from 2022, but as you can see, it's books, it's research articles, it's white papers, and there are links also to some of those who are available online. So the vision and mission from EMEA-NI is that EMEA-NI is the world body for nursing and health informatics, supporting the development of nursing informatics in member countries and promoting the use of informatics in nursing worldwide. There are a lot of elements in the future. There are opportunities for nurses to transform their role, to use informatics in that role. The nurse's traditional patient and family advocacy role will remain important despite the development within informatics. The rapid changing healthcare ecosystem demands that nurses are involved in research, in design, in adoption and use of emergent digital technologies. And technologies will be normalized into the nursing role, and that will require new nursing knowledge and skills, different relationships between nurses and other actors. And we have to follow up on that, and we need your speciality to contribute to that future. This is just some elements of the areas where nursing and nursing informatics will be of interest and of importance. And together we become stronger and can achieve great things. Collaboration is the core of our work, and EMEA-NI is an opportunity to build your knowledge and career within health and nursing informatics. So join us at LinkedIn, and please access our webpage and have a look at more information at the pages. And if you want to join one of the advisory panels that we have, you're welcome to contact me. Thank you so much.